Hello, my fellow veterans. How you doing out there? Hey, first, sorry about last week. I got admitted into the hospital, couldn't do the show, so we're going to have that guest on, I hope, next Wednesday. But today we've got lots to talk about. So let's get started. Hi, everyone. Hey, Tim Hauser, the Gulf War Advocate here, and this is Veterans Central podcast. But today, we're going to talk about pending legislation in the House of Representatives. Hopefully, in a week or two, we'll be able to do the ones that are in the Senate. But there's a lot that is going on as far as the veteran community goes, as far as legislation for veterans goes, that's happening in the House. Now, the reason I'm bringing all this up is because, one, as a community, us veterans need to be aware of what's going on legislatively, not only on the national level, but in the state level as well. But tonight, we're going to concentrate on federal legislation that's in the House of Representatives. And like I said, in a week or two, we'll do what's pending in the Senate. And the first bill we're going to talk about here, and now just so you know, we're briefly touching these because there's quite a few. Now, the first one is H.R. 3584, and it's called the Veterans Care Act. And it was submitted to the House by Representative Miller Meeks. I'm not going to get into what state they're in, if they're Republican or Democrat. It doesn't matter. What matters is what's in these bills and how they're going to affect us as veterans. All right. So, like I said, the first one is H.R. 3584, the Veterans Care Act. And what the Veterans Care Act is going to do is going to require the VA to conduct research on certain forms of cannabis and cannabis delivery to veterans in the VA system. Now, I, for one, believe that pot, marijuana, cannabis should be available to us on medicinal purposes. But until they change federal law, I don't see the VA gonna distribute cannabis to us. All right. But there it is. At least they're going to make the VA research which forms of cannabis and how to deliver it to veterans that are in the VA system. If you're not in the VA system, you probably go get all the medicinal marijuana you need. But us in the VA system, we have to be careful about that because we don't want, some of our benefits taken away. So if this is something you can support, by all means, go to congress.gov, study the bill a little bit more, then start calling your elected officials in your state. Matter of fact, you can call every single congressman in this country and leave your point of view. All right. But the ones that are going to listen to you the most are the ones that are in your district. And you can look that up too on Google. Just type in what district you're in and who your representatives are. Boom. Pops up. Now, this next one is H.R. 3644, Act for Veterans Act. And It was submitted by Representative Latta. I know who Latta is, but we'll go on from there. What this bill is going to do, it's going to extend the authorization period for emergency treatment in non-Department of Veterans Affairs medical facilities under the Veterans Community Care Program. You get so much time in a non-VA facility under the care program, then you have to start paying it out of your own pocket. This bill is going to change that. I think the extended period from rumor is it's going to extend it quite a bit. I think it's from 30 days to like 90. But like I said, go to congress.gov, type in the bill number. It'll bring all the information up about the bill. So this is another one that we should let our congressmen know that we need this bill passed. Just like the one before with the cannabis or the marijuana. I think that needs to be passed too. But like I said, until federal law is changed on marijuana, I don't think the VA is going to be allowed to provide us with medical marijuana. So now the third one. This, I hope everybody gets on board and starts calling their elected officials on. H.R. 3649. Veterans National Traumatic Brain Injury Act. Presented by Representative Murphy. Now, this is a good one, folks. All right. It's going to require the VA to implement a pilot program to last for 5 years to where it furnishes hyperbaric oxygen therapy to veterans with TBI, traumatic brain injury. This type of therapy has been proven to be extremely effective, not only on traumatic brain injuries. I hope somebody puts in an amendment to include toxic injuries, like from burn pits, oil well fires, Gulf War veterans exposed to sarin gas. We all, even veterans with severe diabetes and have foot ulcers or sores from their diabetes, they can get help through hyperbaric oxygen therapy. If you don't know what that is if you know anybody that's gone scuba diving and they go down so deep and they come up really fast, they have to go into a chamber so they don't get what's called the bends. Same thing. All right, you go into the same type of chamber, they pressurize it, put in pure oxygen in there, so your body absorbs that oxygen and it helps heal your body. It's been proven time and time again to be extremely effective. I just hope there's another congressman or congresswoman out there who can add an amendment to this bill to include toxic injuries and veterans with severe diabetes. All right. My very good friend from Michigan, Kevin Hensley, is the leading veteran advocate in this country for this. So let's all jump on board on this. And let's support this bill. This is definitely one we want passed, and we need it passed yesterday. Actually, we needed something like this 10 years ago or even longer. So we need this to pass, folks. So let's get on the phones with our congressman and say, hey, look, this bill needs to pass. Now, I'm going to put, for especially those of you who will be listening to the audio of this, I'm going to put every single bill in the description. The number is going to be in the description. And you can go to congress.gov, type in the HR number in the search bar, and the bill will pop up. So you can read it word for word and see exactly how it's written and how it's supposed to work, who the co-sponsors are. So I suggest, with everything that we're talking about today, go to congress.gov, read it for yourselves, get a more detailed view of what the bills are. All right. Now, on to the next one here. HR 4424, Vietnam Veterans Liver Flute Cancer Study, submitted by Representative Lalota. Very nice man. I met him. Now, what this does, it's going to require the VA to conduct a study on bile duct cancer in Vietnam veterans. Very good bill, but decades too late. Decades too late. This bill should have came out maybe 5 years after the Vietnam War, right along with healthcare for those affected by Agent Orange. Should have been done a long time ago. So here's another one that we do need to get past, though. There are still Vietnam veterans out there. Many of them are suffering from this type of cancer. So, I think the studies should have been done decades ago, and treatments should already been in place. But we know how things work. They take forever to help us veterans out. Now, the next one. This is a good one, too. HR 4424, VA Emergency Transportation Access Act. This one was presented by the House's Veterans Affairs Committee Chairman, Representative Bost. And what this one does is it gives the VA Secretary McDonough, the authority to change reimbursement payments for emergency transportation. See, right now, if you need a civilian ambulance, the VA pays them whatever they request. This gives the VA secretary some control over that so that they're not overcharged, which in the long run is going to save money for the VA, which means improved care for us. So I think this is a good bill. I think this one's going to pass. Well, I don't think we need to be making phone calls on this one, but now this one has me confused. And actually, it has me fucking pissed off. HR 6324. Fiscal Year 2024 Veterans Affairs Major Medical Facility Authorization Act. Let me bring up the next slide and you see why I'm pissed off. Oh, I forgot to put a slide in for that. So let me read it here. I got it right here. What it does, it gives authorization to the VA to carry out specified major medical facility projects for fiscal year 2024 and limits how much they can spend on projects. This was already outlined in the PACT Act. The PACT Act said we need more facilities, build them. This bill, hey, hold up, time out. Before you start building them, come to us and we'll tell you how much you can spend on it. Yeah, and this one's also by the chairman of the House Veteran Affairs Committee, Representative Bost. See, Bost wasn't too happy that PACT Act passed. I'll leave it at that. So he wants to put another bill out on the floor to put even more control on what the VA does. See, before the VA can spend a penny, they already have to submit a report to the Senate. Say, hey, this is what we want to spend our money on. What they don't have to report on is our compensation checks. Okay? But if they want to build a facility, or if they want to renovate a facility, or if they want to buy new equipment, if they want to hire new nurses, doctors, specialists, therapists, psychiatrists, they have to put in a report to the Senate. And the Senate either says yes or no. And this is before they can spend any money. I think they have to put that report in quarterly. So 4 times a year. This is adding more to that. And it was already outlined in the PACT Act. So if he wants to hold up having VA build more facilities to help us out, then this man needs to step on to the side and say, hey, veterans do matter. So this is one we do not want to have passed. Unless I'm misinterpreting it. But this is putting more oversight on the VA as far as building facilities to help us veterans out. Now, I go to the one in Cleveland. Cannot complain about the treatment I get there. At least not too much. But they just built on a brand new emergency room there. And if this new law, now the emergency room was built because of the PACT Act. And that hospital needed a new emergency room. Everything's updated. The equipment's updated. It's not from the 1960s. It's all brand new. They can take care of us better in emergency situations in Cleveland now because of the PACT Act. Now, my good friend Becky Lee wants to remind us that Bost is a veteran too. And yes, Becky, I agree with you. It's very ironic that he does not like the PACT Act. Don't know why. He never really came out and said. But that's what that is. So let's move on to the next one here. This is another one we want passed. HR 6373, Veterans Stand Act. And this is submitted by Representative Bergman. And what this bill does, it's going to direct the Secretary of the VA to offer annual preventive health evaluations to veterans with spinal cord injuries or with spinal cord diseases. I believe the diseases one is added on as an amendment, but this is needed. There is an entire ward at the Cleveland VA hospital that has spinal cord injured veterans that live there. I get to visit these patients once a year when I do my Christmas card drive. They want this so they can go home, so they can go to where their families are at. Instead of their families come to see them for a couple hours in the hospital. They want to be able to go do family things. This will help them do that. So let's help our brothers and sisters out, and let's hope to get this one passed. Now, like I said, with the hyperbaric chamber bill, hopefully they put an amendment on it to include toxic injuries and severe diabetes in that, instead of just having it for traumatic brain injuries. This one does have the amendment to where it's adding spinal diseases as well. All right. Now, the reason this one has the entire summary up here is because that's what the entire bill is. It's word for word, the entire bill is on this screen. HR 7347. Submitted by Representative Van Orden. And it is to amend Title 38 of the United States Code to direct the Secretary of Veterans Affairs to report on whether the Secretary will include certain psychedelic drugs in the formulary of the Department of Veterans Affairs. Now, there is a big, huge push to get psychedelics added for treatments for PTSD, traumatic brain injuries, cluster headaches, basically all the head stuff associated with toxic exposure. And traumatic stress. I, for one, if it works, put it in there. But like I said, the entire bill, word for word, is up on this screen. This is the entire bill, the entire text. My good friend, Joe McKay, 9/11 firefighter, fought for his benefits because of his illnesses associated with working at Ground Zero. Then he came and helped us veterans get the PACT Act passed. He is now leading the fight for psychedelics for cluster headaches. And I'm backing him up. So this is another good bill. Now, this next one here, HR 3225, Build for Veterans Act, submitted by Representative DeLuzio. This bill is going to force the VA to report on capital assets. Now, here's the thing. This is something they already have to do. Now, you can look up what capital assets are. But I'm going to tell you. It's the people that work at the VA. It's the departments that they run. It's your doctors. It's your nurses. It's your administrative people. It's even the young lady that says, last name and last four, please, when you're checking in for your doctor's appointment. That's capital assets. So I don't, they already have to report on that, I think, quarterly. I know annually, but I think they also have to put in a report quarterly. So this bill, I think, is worthless. But y'all can read it on Congress.gov and see for yourself. But I think this one's worthless. Now the next one. Unfortunately, I'm going to have to agree that this one is needed. HR 5794, Veterans Affairs Peer Review Neutrality Act. And this one's submitted by Representative Dingell. And it's to eliminate conflicts of interest in VA management and investigations. Now, I'm going to kind of steal a little quote from my good friend on this one. If the VA is such a fantastic organization, why do we need a bill like this? Because, I guess there are some conflicts of interest going on, and they need to be solved to better help us veterans. So, yes, this one needs to be passed. And it probably will. We got a few more here. Plus, there's some updates to tell you about too. So, don't worry. We got some more material. Now, this one we need passed for our sisters. HR 3303, Maternal Health for Veterans Act, submitted by Representative Underwood. Hey, our sisters that came back from Afghanistan, Iraq, the young ladies. Sure, when they get out, they most likely want to have a family, right? They want to have children. So this is going to have the VA report annually on activities relating to maternity health care. I think it should be done quarterly. And I think the VA should improve their maternity health care for our ladies. So let's get on the phones and let's get this one passed. Our sisters need this one. All right. Let me go back one here because we got another comment from Becky. I love getting comments from you, Becky. So Underwood's also a nurse. All right. So a nurse should know what they're talking about. So yes, let's help our sisters out. Let's all call on this one. Let's get this one passed. All right, on to next. This one I think is pretty cool and needed as well. HR 5247, Expedited Hiring for VA Trained Psychiatrist, Act of 2023, submitted by Representative Cartwright. Now this one's cool. So this bill authorizes the Department of Veterans Affairs to appoint a psychiatrist who completes a residency at Veterans Health Administration facility to a VA healthcare position immediately after such residency without regard to civil service or classification laws if, one, the psychiatrist meets the qualifications established in regulations prescribed for the position, and two, the position has been unfilled for at least 35 days. Now, here's the deal on this. They're already working in the VA to finish up their degree, because all doctors have to do an internship and a residency. All right. If there's an opening at the facility they're at for a psychiatrist, they can bypass the interview, they can bypass a bunch of red tape, and they can just give that position to that psychiatrist if they want. Now, me, I am one who uses the mental health care that the VA offers. So if they can get more psychiatrists in, I think that's a good thing. So I on good word already hear that this one's going to pass. Okay, and it should. This is a good bill. So we know that's going to be all right. All right. Now this is the last bill I'm going to discuss, and then I got some other stuff to go over here with you too. HR 2413, Dental Care for Veterans Act, submitted by Representative Brownlee. Every veteran needs to be calling their congressman now on this bill. You see, in order to get, well, let me tell you what this bill does here. All right. It's going to expand eligibility for veterans for dental care provided by the Department of Veterans Affairs. See, right now, the only way you can get dental care in the VA is if, one, you have a service connection dental health issue, service connected. Okay. Two, if you are 100% service connected for other things, you can get dental care through the VA. Third, if you're a Purple Heart recipient, then you can get dental care through the VA. The rest of you have to go out on your own to get dental care. I think that's bullshit. I think all veterans in the VA system should be allowed to get dental care through the VA. Little story. And I know you're all going to like this. During the PACT Act, I was at the Senate hearing on the PACT Act, and they were questioning Secretary McDonough. One of the board members, Senator Bernie Sanders, waited quietly until it was his turn to ask the secretary questions about the PACT Act. And as soon as they turned his mic on, all you heard is, "What the hell are we doing here? Why are we here? Give the veterans what they want. Give them the health care that they need. Matter of fact, they all deserve to have dental care as well. Amen there, Senator Bernie Sanders. I agree with you. And I think every single veteran agrees with you. I know Becky Lee does. Becky says, veterans have served and deserve comprehensive, high-quality health care. All veterans deserve dental health care. Yes, 100%. Now, the reason I'm all for this and I'm all pumped up on this one because, number one, if you don't have good dental health care, the rest of your body falls apart even quicker. If your mouth and teeth aren't taken care of, you get heart disease. Don't take care of those teeth and that in the mouth, you get liver disease. If you don't take care of your mouth and you get gingivitis and that's not taken care of, that gets into your blood system, boom, you die. Dental health is the backbone of all health care. Oh, I think I got Becky fired up a little bit because 100% facts. Yes, that's right, Becky. Dental care, taking care of your teeth and your mouth, is the backbone of all health care. Ask any dentist in this country, they'll agree with it. Matter of fact, you ask any doctor in this country, regardless of what they practice, is going to agree with that. Dental care is the backbone of all health care. You don't take care of those teeth, you don't take care of your mouth, the rest of your body falls apart quickly. So this is why we all need to get on the phone and get this one passed. This one's getting some resistance, and I don't know why. So let's get on the phones. Let's get this one passed. All right. Now, like I said, I'm going to put every single bill number in the description so you can research these bills on your own as well. And before I go on to the next subject here, those of you who are watching live right now, if you have any questions or any comments, please, like Becky does, put them in the chat. I will read it. I will get you on the show. All right. So, on to the next issue. This is fucking beautiful here. I have been looking into getting a service dog. And I can fully admit that I am extremely proactive in my health care. I have to be. I have interstitial lung disease from burn pits and oil well fires. I'm dying a very slow death. We're backing up a second to go back to the dentist thing, the dental care. HR 2413. Well, thank you for reminding me, Becky. This is going to save the VA money. Big time money. And like Becky says here, prevention costs less than expensive treatment of advanced medical problems. Fucking amen, Becky. Oh, hell yeah. Thank you for reminding me on that. I'm going to say it one more time. Dental care is the backbone of all healthcare. Take care of those teeth, take care of your mouth. A lot can happen to your body if you don't. So now let's go back to the service dogs. So I stay extremely proactive in my healthcare. I check what the doctors put in the notes on My Healthy Vet. I read what the reports and lab tests and x-rays and C scans and MRIs say, and then I go over that with my primary care doctor. So, knowing there are times I can't control my PTSD and my nightmares get the best of me, I started looking into getting a service dog. During my research, I went to va.gov, Veteran Affairs website, and I typed in service dogs in the search bar. Boom, all kinds of links pop up. And I saw one that says service dogs through the prosthetics department. I thought that odd at first, and then I thought about it. That's a very good department for that. Here's why. Service dogs are an extension of you, just like a fake leg or a fake arm. Okay? They're considered a tool to protect you and your health. So that's why the prosthetics department handles service dogs. Now, one thing it states too is the VA does not provide the service dog for you, but they assist you in obtaining one through organizations that are VA approved. So I looked into this and I clicked on that link for the prosthetics department, and it lists exactly what the veteran has to do if you need it for health mobility issues. You go through your primary care doctor, and they send in a consult to the prosthetics department. If you need one for PTSD, like me, you're supposed to go through your mental health provider, which I did. And I was told no. It wasn't because they don't think I don't deserve a dog or I need one or don't need one. They said that what is printed on va.gov is a lie. It is a misprint, and it should not even be on the website. So I went to Patient Affairs. It says, hey, this is what's happening, but yet it's on the website. They brought the website up with me in his office, and he found the law that handles this, but doesn't say anything about mental health in the law. So he's like pretty much out of luck. I says, no, I'm not. If it's written on va.gov, that's policy. That has to be followed. He says, well, let me look into it. I'll give you a call back. 3 months later, no call. Typical. We'll get into the no return phone calls here in a minute. But so I was invited to the State of the Union address by my Congresswoman, Amelia Sykes. She arranged TV interviews. Then we attended the Veteran Affairs Committees, the House Veteran Affairs Committee's press conference. Secretary of the VA, Secretary McDonough, was there. A congresswoman arranged a 15-minute meeting with him. One of the things we talked about was service dogs. And he had his laptop there, and he brought up the webpage. He went straight to, he goes, I know exactly what you're talking about. Went straight to it. He says, this is my policy. He goes, yeah, I know the law. He goes, I can add to the law. I just cannot take anything away from the law. But if I feel there should be more veterans available for service dogs, I can say that. And that's my policy, and it should be followed. And he brought up some hospital. I forget what state it's in. But he said that VA facility is doing an outstanding job in helping veterans obtain service dogs. So he said, Tim, I'm going to look more into this. And you want me to call your cell phone or your work phone? I said, call my work phone. I've gotten 2 updates from his office already. 2, there's a big problem nationally. Veterans are being denied service dogs for PTSD when it states right there on va.gov that they're eligible. And it's not because their provider says they don't need one. It's because they say it's a lie. And yes, Becky, she said Secretary McDonough can add to the law, just not take anything away. See, that was one of the big things about the PACT Act. Once he felt that we were right, we needed the health care due to toxic exposure, he pushed so hard to get the PACT Act passed, because once it's law, no secretary can take it away. No other. If he loses his job tomorrow, the PACT Act will still have to be followed. Now, the law, I don't think I have that in here anymore. No, I don't. The law states for like a diabetic or somebody that's blind or has a balance problem, the VA can help assist the veteran in getting a service dog. And here in a bit, I'm going to tell you why it's important to go through the VA for a service dog. But in the law, it does not state anything for mental health. So the secretary has the authority to add to the law. So he did in this instance, without going through Congress to get an amendment added. And he says he's probably going to ask for that to happen now, because he's finding that 95% of the facilities in this country are not doing what they're supposed to do. So, like I said, he called, said there's a huge problem nationwide that he was not aware of. Matter of fact, my congresswoman even chimed in during the meeting and says, hey, I've gotten several phone calls on this. And this is just one district in one state. So got a second phone call today. They're writing up the letter to go out to all the facilities saying they need to follow what's on va.gov as far as service dogs go. So his office is supposed to call me back once that letter goes out. Now, here's why it's important that if you think you need a service dog, on why you should go through the VA to get one. If you were approved, not everybody's going to be approved for a service dog through the VA. All right. Because it's all based on what's in your medical records. But the thing is if you are approved and they help you obtain a service dog, one, they're going to pay for your travel to go get trained with the dog. Two, pay you travel to bring the dog home. Three, once you and the dog complete training, the dog is now eligible for health care insurance paid for in full by the VA. You don't pay a penny for health care for the dog. The VA does. You also get free leashes and harnesses for the dog. If the dog is prescribed a diet by a veterinarian, that food is paid for. Now, if your dog needs grooming, that comes out of your pocket. Food comes out of your pocket unless it's prescribed by a veterinarian for a special diet. Then, you have to pay for the food too. Small expenses compared to what healthcare bills for animals are. Almost as bad as our hospital bills. So, but there's that. And I'll keep you all informed on how that's going. All right. Now, about the returning of phone calls. I don't know if this is happening nationwide, but it is a problem in Cleveland. You call a certain department, and I'm going to call out the one department right here, Travel Pay. As you all know, last year, we had up until June 15th to be able to go back 2 years to file claims for travel. Because if you're 100%, I think it's 45%, you're eligible for travel pay for every appointment, for most appointments that you go to at a VA facility. The percentage I might be wrong on. You'll have to check on that. But we're eligible for travel pay. I didn't know till a nurse said, "Hey, Tim, here's your travel voucher. Fill it out. Go turn it in downstairs." She says, "I'm not eligible for travel pay." He says, "Oh, yes, you are. You're 100%. Put in for that travel pay." They pay for mileage. Okay? So I put in my travel pay claims to be able to go back 2 years, almost a year ago. Haven't heard nothing. I've called and called and called and called. Always get a voicemail saying, "Please leave your name, spell your name, last four in your phone number, and we will get back to you within 3 days." I called a week ago. It was the last time I called. I haven't heard anything. All right. Even if with being able to go back 2 years on travel pay, I know it put a burden on that department at every VA facility. And it got them backlogged. But come on, it's a year. All I'm asking is for an update. If you're having that problem, I was lucky enough to be able to tell the Secretary of the VA in person that I had that problem. So they're checking on that too. So hopefully that's not happening to anybody else. Hopefully I'm just a oddity, but I don't think I am. So there, if you Google contact for Secretary of Veterans Affairs, it comes up, gives you can click on a link, you fill it out, leave your name, last phone number, and your message, and then his office is good. They get back with you. Because I know other people have contacted his office, and they get response back within a few days. So hopefully I get some more updates here in the next few days on service dogs, so we get this problem fixed nationwide. Now, little update on my endeavor in trying to get a National Veteran Suicide Awareness and Prevention Day. The state of Ohio my state senator has submitted a bill in the state of Ohio, SB 225, naming September 22nd as Veteran Suicide Awareness and Prevention Day for the state of Ohio. Nationally, I'd have to say, after the State of the Union, I've got more than several, over a dozen. I'd have to say more like 35 to 40 congressmen all for this and helping me get this going. Senate side, I know I've got one senator, and that list has probably grown. So something tells me here very soon I'm going to be able to give you a very good positive report on that. I know the bill in Ohio, it's in the Veterans and Public Safety Committee's hands right now. I'm drumming up support for that. And I know that'll pass. I think we got enough support, at least in the Senate, to where it'll pass the Senate. I've got contacts for congressmen in Ohio to where we should be able to get that passed for Ohio. So, but thanks for listening to me today. Sorry about last week. Hey, couldn't help it. Had to get hospitalized. So, but we'll get that guest on here real soon. He's excited to come back on. But the guest he was on before for one nonprofit. This is for his second nonprofit. So he runs two nonprofits. And we're going to talk about his second one, which is really cool. But we'll leave that up until we can confirm that he's actually coming on what day he is coming back on. It's just what day we don't know yet. So he's a very busy man. So like I said, these bill numbers will be in the description so you can research them on your own. I'll put in the link to congress.gov. That's where you go to find anything out about a bill. You can, if a bill's been put up for a vote, you can see how every single congressman or senators voted on that bill. Tell you who the co-sponsors are of those bills, the whole 9 yards. All right. And again, Becky, thank you so much for coming on and adding to the show. You're awesome, lady. I appreciate you. All right, folks, we'll catch you next week.